Increasingly, we see a two-track pandemic. Many countries still face an extremely dangerous situation, while some of those with the highest vaccination rates are starting to talk about ending restrictions.
The World Health Organization says glaring COVID-19 vaccine inequality has created a two-track pandemic, with Western countries protected and poorer nations still exposed to the virus. WHO Director General Tedros Adhanom Ghebreyesus said this at a media briefing at World Health Body's headquarters in Geneva while campaigning to get more vaccines to developing countries. Mr. Ghebreyesus said unequal distribution of vaccines had allowed COVID-19 to continue spreading, therefore increasing odds of a variant emerging that could render the treatment ineffective.
In countries with the greatest access to vaccines, we're seeing a decline in mortality among older age groups. In these countries, the public health and social measures that have helped to protect people are being eased, but they must be eased cautiously. 6 months since the first vaccines were administered, high-income countries have administered almost 44% of the world's doses. Low-income countries have administered just 0.4%. The most frustrating thing about this statistic is that it hasn't changed in months. Inequitable vaccination is a threat to all nations, not just those with the fewest vaccines.
As of Monday, there were more than 173 million confirmed cases of COVID-19 globally, including 3.7 million deaths. The Director General reported that new cases had dropped for 6 weeks and deaths for 5 weeks. Tedros, however, warned that despite a global decrease in number of cases, 3 out of the 6 WHO regions, that is Africa, the Americas, and Western Pacific, are seeing an increase in the number of deaths. As leaders of the group of 7 rich nations G7 meet this week in the United Kingdom to discuss major crises, Tedros called on leaders to commit to share doses by June and July. Kamel Sadiq reporting for CBA TV.